Hey, it's Mariska from the Neuro Studio, and I'm back with Dr. Allison Bloom at Capital Ketamine, which is also the place where I have had ketamine infusions. And in this episode, we're going to talk about the process and sort of what to expect. I'll talk about what I experienced, and I'm going to ask her about what some other people experience, which might not be the same as me. Maybe it's cooler. Maybe it's less cool. Mine was really cool. So I come in for an infusion of ketamine. What is the process?
So the process typically is, if it's your first time, we're just going to verify your weight to begin with. Once we get you in the room, we have a conversation, really just how you're feeling that day. A big part of ketamine, we call it set and setting. So setting is literally the physical. Are you comfortable? We have chairs that recline. Do you want a weighted blanket? What's the temperature like in the room? Do you want a dark room? Do you want a little ambient light that we can put on? So, physically, how are you feeling? And then, really, the set, your mindset. How are you feeling? Patients that come in who are running 15 minutes late are generally very harried and not super happy when they walk in the door. We want to erase that before you start ketamine because your brain is really malleable in that moment. So if you come in harried or had a bad telephone call or bad news right before you come in, it often influences your experience here. So the first thing is just we're taking a gauge of your temperature, how you're just feeling that day, where's your headspace at, and often some intention setting. Some of our patients will write a little bit in the journal what they want to go get out of this experience. Is there something traumatic they want to revisit? Do they want to speak it into the world? What they want to get out of this experience? So really, that's the first thing, is just setting you up for success. The next thing we do is determine the dose. So typically weight-based, and again, we usually start at the scientific measured dose of 0.5 milligrams per kilograms. We'll get some vital signs, meaning we'll check your blood pressure, your pulse, and your oxygen level, just to make sure all that looks ship-shape before we begin. Then we'll place an IV, generally pretty painless, honestly, for most of our patients. We also have some numbing spray we can use for patients that struggle with that a little more. Once the IV's in, we do typically recommend that our patients are given a dose of an anti-nausea medication. And we do ask our patients we have a fasting regimen. We don't want you coming in with a full stomach in case you do develop some nausea during the treatment. And then we get you really hooked up to our little blood pressure machine, little pulse ox on your finger that measures oxygen, get you comfortable. A lot of our patients use eye blocking shades that we offer here. And music. I think music is really important. You could talk a whole nother
I have
session
my
about this.
my ketamine playlists. So
Yeah.
because I actually think the music is really interesting. Mm-hmm. So because I've done so many random medical things in my life, I was very into doing binaural beats. Mm-hmm. And I also wanted to pick something that was a frequency that is supposed to activate your brain in a certain way. But I remember you telling me that you have a guy who plays heavy metal.
Yes.
And I'm like, that seems very much not the experience I want to experience.
Yep.
Because I'm like, sound bowls and chimes and whatever, but at certain frequencies, and he's,
rocking out.
Yeah. So is my musical choice more standard?
I would say yours is more standard.
Okay.
Yes. And what's amazing is you can now find hundreds, if not thousands, of ketamine playlists on servers like Spotify. It's just
you can find my ketamine playlist on Spotify.
Yes,
I do have one.
Yes.
Okay, so then you're in the room.
Yes.
You're in your little recliner chair, and then how long does it take for the ketamine to kick in?
Yep. Typically, I would say, so we start the infusion. It's run over 45 minutes. Again, the machine is programmed to deliver just a little medicine, every minute. And I would say most of our patients, around the 10 to 15 mark, are really feeling it. Some may be a little quicker, some a little more slow. It's often the patients who say, "I'm not feeling anything," and then literally a minute later, they're having that experience of dissociation. So again, it's not again, not general anesthesia. We don't give it to you when you go to sleep. And the goal, again, is not to put anyone to sleep. We've done that. We've failed the patient immensely. But usually it's about 10 to 15 minutes before a patient really starts feeling that.
And then how often do you check in?
So typically we come in every 15 to 20 minutes. We just push a button, take a quick peek at you, check your blood pressure, pulse, oxygen, and really we try to be as quiet as possible. We don't have a conversation with you. We don't really want to, break your experience, the dissociation that a patient may be experiencing. And for that reason, with some of our patients too, if they're not using music, we'll do like a noise canceling headphone or earplugs as well. So every 15 minutes to 20 minutes for vital signs. And then we give an hour of recovery once the infusion ends. Most of our patients feel, I call it, back in their body at the 20-minute mark. And they're able to converse with you, may still feel a little wobbly walking. So I would say most of our patients are here for a solid 40 minutes after the infusion ends, just getting their sea legs under control and awake, alert.
And I will say my walking is not good after ketamine therapy because it just makes everything feel really wonky for me. That usually lasts about an hour and a half, and then it's fine. So it doesn't stick around.
Right.
I will say sometimes afterwards I'd have a headache. Is that common?
It's funny. We have a lot of patients with history of depression, chronic pain, and migraines, which ketamine often helps. Again, just as an anesthetic. I think part of when patients tell me they have a headache, I think a lot of it's linked to the fasting.
Yeah,
because
that makes sense.
This is not we ask patients often to fast. I'm sure not everyone does it. 6 hours. Really, that's the safe timing of it. So I think a lot of it is probably a little dehydration, not having eaten. So I, not to say it's not the ketamine, but I do think that's a big factor.
And I always would come in a morning appointment because I didn't want to be fasting for that long.
Exactly. A lot of our patients are like that.
So when you were talking about, trying to be quiet when you come in, it's my understanding that some people do ketamine therapy with their therapist there. So, and that seems to me, having experienced it, like that would not work at all.
Yeah.
But does it work for some people?
So there is, we call it CAT, ketamine-assisted therapy. So you're given, a dose of ketamine, and then you do therapy. We've had several patients try it here, and my conclusion and my partners is that the IV formulation is just too strong for someone to participate meaningfully with a therapist in the room. Certainly, I think it's possible during the second hour, once you've kind of woken up and recovered, to process. And we have quite a few patients who tried it and didn't do it again. They felt it was, honestly, a little bit of a waste of their time. And they really didn't want to be bothered during the experience. They really recognized it. It felt like a bother to try to speak to someone and express themselves. So I think it's possible the nasal spray or, the lozenges, I think it's a lot less potent, and patients can have meaningful conversations during therapy. What we recommend for our patients is if you're coming in the morning, maybe have a late afternoon appointment, or even 24 to 48 hours later, you will still have that experience saved. You'll still feel vulnerable enough to share what you experienced, in the chair.
I would say that my thing that I feel most sad about after ketamine is you can't remember the entire experience, because to me it's so cool. Yeah. It's just really cool. And you still haven't done it, right?
No, I have.
You have done it?
Yeah.
Finally. Okay, so when I was coming here, none of the doctors here had tried it. And I was like, how have you not tried it? So I actually want to know, when you tried it, what was it like?
Yeah. For me, it was a little, very low dose. And it was just kind of a floaty experience. Now, personally, I wasn't working through anything. I didn't say, I just wanted to be able to experience it so that I could speak more meaningfully to the experience. But definitely a floaty sensation, a happy sensation, a very calm sensation. It's been a while now, I have to remember. But very pleasant for me. And just kind of felt like ambivalence, peacefulness.
Did you have any, because I had this, so did you have any, like, where you felt like you were in a huge space?
I didn't experience that. I know you talked about that kind of that expansive effect.
Right.
I did not experience that.
Oh, that's a shame. Yeah. That's a good one. So for me, why I say it's like sad that I don't remember is because like it's just so interesting. So to me, I didn't come in and set any intentions or whatever. I always thought it would be cool if my deceased mother showed up and talked to me. And you said some people have
Absolutely.
that. And you said one woman even comes just for that.
Yes.
Which I'm like, that's super cool. That did not happen for
Absolutely.
me. So I would say what would happen is kind of a mix. It would be like I would keep changing scenes. Like I would be in a scene, and I told you the very first time I remember the way I described it was like if I was in Dune. So you know how in Dune it's like everything's just very
yellow and white,
and it was sort of those colors. But I've also had, but that was just one scene, and then I always feel like I'm moving, which I think is really cool. So you have a sensation of moving through these things, but then you might be in a room that looks more like a normal room, or you might be in something you feel like you're going up super high. And the thing that is always so strange to me is how big everything feels. And you know you're in this little tiny room sitting in this little chair. And the way I would feel afterwards is like super happy. Not like a little happy.
Yeah.
And you said, I remember, I think it was our first time, you said sometimes people wake up and they say, did I die? But no one seems upset about it.
Yeah.
Which I feel like, one thing I felt, which I thought was so interesting, is I felt like where I was real. And that this isn't. And when you start to, and I would sometimes like have people be brought in, or I'd have like a scene, like I wasn't completely sure my husband existed, but I would think of him, but I wasn't completely sure that was real. And I thought of my dog, my favorite dog, but I haven't, and there would like be a little scene of me walking, but it all felt like very much like, oh, that's not real. And this place where I am now is real. Which to me made me almost have the sense that if that's what happens after you die, that is awesome. You know, that I'm just like, oh, how cool. You know, because you just are so disconnected with all the bullshit and all the drama and everything that you're just like, you're just kind of experiencing this really cool visual thing and sensation. What would you say are the ranges of experience that people have?
Yeah, I mean, yours is, you echo so many other patients. It's fascinating. I had a patient the other day who said, I feel like I get broken down into literal atoms, and then as I reemerge, you know, my body gets put back together, and there's no fear, there's no anxiety about it, and kind of that same idea that if this is what it's like after I pass, then, you know, how welcoming and peaceful, and that just would completely erase any fear of, you know, death. We have a lot of patients talk about that. So that's a very interesting, it happens all the time. A lot of our patients do have spiritual experiences where they're able to interact with someone who's passed, have conversations. They're able to feel like they want to get forgiveness for something, or let that person know that they forgive them, and it's just a very meaningful experience for them. We have patients who do go back and experience something traumatic, and you know, sometimes during the infusion they're crying and they have literal tears. The best is when someone who's really feeling down, and it's been years, and they've had suicide attempts in the past. The best feeling is when a patient comes out and said, I don't know the last time I felt joyful. I fully feel joyful right now, and I forgot what that feels like. It's like Christmas morning, and I forgot what that feels like, and it's very emotional, and it's emotional hearing people tell their stories, because to think that this anesthetic can make patients feel joy.
Right. Like I found that I would be randomly singing, And I was like, I can't remember the last time I would just be randomly singing, you know, because I feel like it's very common if you have like a chronic illness, just the stress that you're always under, just kind of, you deal with it, but you compartmentalize it, and you know, not that you can't be joyful or experience joy, but there's always a heaviness to just life being kind of hard. I know that when people do like ketamine therapy for like depression, there's sort of a 6 session is sort of the standard. How did that become like the standard? Because I will say that I felt good after 1, and after 3, I felt like it stuck. Like I felt good, but it didn't stick around. And then it was really around 5 or 6 that I felt like my spasticity was getting better. And since, because obviously there's no set, this is how we treat MS, you know, after that I would try to come like once a month or once every 6 weeks or something. So if somebody's doing this, how do you figure out how many times?
Yeah, I mean, we really do follow the research. And right now the research shows that it does seem to be 6 sessions. So, you know, when we're looking at research, we're looking at, you know, how many people start responding, when do they start responding, you know, what's the biggest growth of capture of patients? Because there are patients that don't respond to ketamine. They don't, you know, it's a neat experience, or I felt good, but it wasn't lasting. The 6 infusions really seems to be the sweet spot for patients, where we capture the most responders and that durability effect, that it's not so transient. You know, so you do 1 and you say, that was a really neat experience, but maybe in 2 days you feel kind of right back down in the dumps. After 6 is when we start seeing some long-term durability to ketamine. Patients start feeling better weeks out, even months out. So that's where that research is. And obviously what's safe for patients, you know. There's no doubt that we can't sit here and say the risk of ketamine addiction is 0. But when ketamine's given inappropriate dosing, following the protocols that have been researched, it's very safe, and if you're giving it up to the appropriate patients. So 6 infusions does just seem to be where efficacy is best, and durability.
I had, after I did the 6, I think I did the 1 session with the other doctor who's an anesthesiologist. And that was more of a treatment for pain. So well, first of all, I will add here that she gave me an anti-anxiety medication, which I didn't need or really want. And that ruined the whole fun experience of ketamine. So can you talk about why you would give an anti-anxiety medicine and what it does to the experience, but also what are things that people are using these longer, because I think it was like 5 hours, and it was like, I think it ended up being 100 over the 5 hours, 100 milligrams.
So sometimes, and we do this in our clinic, sometimes patients are just very anxious, and maybe they're coming in for a generalized anxiety disorder. They're very worked up by the idea of an IV being placed. So some of those patients do need something, and just like if you go in for a surgery, the anesthesiologist often gives you something just to calm you down, because your heart rate's up, you're breathing a little faster, you know, you're a little shaky even before, you know, procedure begins. So most commonly there is something called a benzodiazepine, which is the same class as Valium. We give a little Versed, and a lot of our patients like it because it just kind of takes the edge off before we begin. Again, that's patient preference. It can blunt the effects there's no doubt about it, it can blunt the effects of the ketamine experience. For some patients. Some patients say, I still fully dissociate, I still experience all the cool aspects. Other patients feel like they have a more blunted response to ketamine when we give it. For chronic pain, I could absolutely see if you're going to be on a bed for 5 hours, they may want to give you a little something just to prepare you for that. The pain protocols are, I would say, not as established. When we're using ketamine for chronic pain, there are clinics in the area, and typically they are anesthesiologists who do a 4-hour pain infusion. Our clinic offers 2 hours. Sometimes we'll do 3 hours. And the dose is usually higher. You're getting it obviously for a longer period of time. So you're getting much more ketamine. You're here for a longer period of time. There's a longer recovery. And so when you're moving up in that dose, that's where we often lose that cool dissociative effect that we see when we're using it to treat mental health disorders, because we're using that lower sub-anesthetic dose for patients. But as we go up, we're going to lose that dissociation in patients. They get sleepy, very sedated, but often they don't experience that neat phenomenon that a lot of patients have at the lower doses.
Is there anything else you would want somebody to know about the experience if they're really concerned and they're like, I don't know.
Yeah.
Like, especially people who have maybe a negative thought about a drug, because they're like, this is a drug. Not that everything isn't a drug, but that this is a recreational drug or whatever.
Yeah.
Like, just the seriousness of what you actually do.
Yeah. I mean, I think what patients have to understand is ketamine is an anesthetic, right? It's a dissociative anesthetic. It was FDA approved. It's been around since the 1960s, used on the battlefields of Vietnam. All medications are sources of abuse, quite frankly. Patients can abuse a myriad of different, medications. And just because a medication is being used off-label doesn't make it bad, I think about patients who, for headaches, sometimes some of those patients take, a beta blocker. Often we're just using medications for off indication that aren't necessarily FDA approved, but it doesn't mean it's not safe. So I think it's important for your audience to know that all of our patients who are already taking medications for depression and anxiety, they are still taking those medications. Ketamine is an adjunctive treatment. IV ketamine is not meant to be used as monotherapy for, depression or pain or anxiety. And the reality is patients who take things like, Zoloft, Paxil, Wellbutrin, we're happy if those medications manifest a 40% efficacy in patients. That gets them an FDA approval. And ketamine is actually showing significantly superior response rates of patients who have been on these medications. So we're seeing response rates of 85% in patients who have tried everything. So I think it's a mistake to say, well, that's a drug of abuse. Patients who have really suffered and aren't getting the responses they want, who are just getting by on their medications, this can be, the tool in the toolbox that finally lets them not feel so numb.